Do you know someone who hunches over whenever they walk? It's estimated some 8 to 11% of Americans suffer from it, especially those ages 56 and older. We're going to get some answers today on how to treat it and one procedure that could fix it. With more on this today is local neurologist Dr. Chad Domingue. Thank you so much for joining us.
Good afternoon. Happy Thursday to everybody.
Happy Thursday. So what causes this and what exactly is it?
Spinal stenosis is the medical term for the symptom you're describing. It's one of the most common disease processes we see every day that we don't know we're looking at. And what spinal stenosis is, I always compare it to an engine in a car. Over years of wear and tear, you build up gunk in your car. Well, the same thing happens to your spine. You could develop bone spurs, ligament growth, disc pathology, and all those things can cause pinching of the nerve structures, and that leads to the symptoms you're describing of kind of leaning forward to make things better.
So what are the symptoms so people will know that they're dealing with this particularly?
So the medical terminology of the symptom is what we call neurogenic claudication. What that means is as we stand up straight, our spinal structure gets tighter, and so those ligaments push on nerves and it causes numbness, weakness, cramping in our calves. So when we lean forward, which is the little lady pushing the buggy syndrome, we open up those structures and relieving some of the pressure in that spine.
You also say that, you can get injections for this, but talk about a procedure that could possibly fix it for many people, and who would be the best candidates for this?
Yeah, with any process, Liz, we always talk about starting simple. Physical therapy, chiropractor, those type of things. Unfortunately, when you're dealing with spinal stenosis, those things usually fail. The next step would be a steroid shot, very similar to what we do in knees, ankles, elbows, what we call an epidural steroid injection, where we're administering the steroid into the tight structure. After that, which is where many people live, there's a new surgical procedure called VERTIFLEX, which is a little medical device that we insert in between the bones, which allows basically what you're doing when you flex forward. It allows opening of these structures. If that fails, if the stenosis gets worse, then you have to see a spine surgeon and cut a lot of these structures out, what they call a decompressive procedure.
And in the meantime, as we all age, are there things we can do on a daily basis, my last question to you, to try to prevent this in the future?
Yeah, spine health is just like everything else, right? You got to lift appropriately. You got to make sure you're taking care of your spine. When I go to the gym, it's not just building muscles in your arms, but you got to build those core muscles. Anything you can do to strengthen those core, Pilates, yoga, stretching, decompression, those are all things we can do to prevent this disease process.
Well, it sounds like some good advice that we can all use. And in the meantime, thanks for enlightening us on some of the solutions medically. Appreciate it. Have a great day.
All right, Liz. Always a pleasure. Good seeing you guys.
Thank you.